an association, something like that in Australia. So sometimes it's very, very easy to, very easy. Right?
No, you have to stay away from the speaker.
Yes. Hello?
Yeah.
Okay. It is very easy sometimes. I have, I don't know, many women that had to be cut in the uterus that are free.
The arm bucket.
Completely free.
So how did she take the sodium bicarbonate?
She, the woman, the last woman, she's inserted a catheter and she into the bladder. Then she flushed sodium bicarbonate 5% solution for at least 2 months or months and a half.
Every day?
No, there is
Regular.
no, I cannot. If you go to my website, you can
Okay.
find it. But you have to do usually from the third to fourth day, the colonies regress. From the fourth to the fifth, they collapse completely. So usually in 6 days, a patient can heal. 6 days. Even in 1 day, you can see how the tumor can shrink. But everybody can think what he wants. It's important to have evidences. I can speak 1 hour, 2 hours about something, but I have no evidences. If you have some evidence, I don't say that I am right, but you have to take in account that there are other evidences. So this is the problem. Oh, it doesn't work neither. What can we do, my friend?
We hear you.
Oh.
The speakers are out up here.
Okay, I will.
You don't need the microphone.
Okay,
You
okay,
don't need the
let's
mic.
go.
The mic's not working.
Okay. We are here. Okay, let's go on. So, if somebody wants to speak about tumor, has to tell me the
I have no
subject.
place to plug that in.
If it says maybe this, maybe that,
So you can
maybe
reset
it is died, maybe it is whatever you want, no, that is not me. I can be confidential, but I say I have one idea, clear, simple with the results. Then we have to investigate. Okay.
Don't go past it.
Very high, I told you. So, in close contact. Orally for the mouth, intravenously for the lungs, local injections for breast when it is like cyst or for soft tissues, colonoscopy for the colon cancer, selective arteriography, you saw it, catheters into the cavities, mesothelioma for the pleura or metastasis in the pleura and peritoneum, and operation when the mass is too big. If there is a huge breast cancer, you cannot drink sodium bicarbonate. You have to remove the mass, and you have to flush sodium bicarbonate during the operation, to leave a catheter during the operation, after the operation, to manage it for 1 month long, to sterilize the roots when the patient heals. The women that before I counseled was a woman from Los Angeles with a big tumor here. I could spare the breast in 12 days, 13 days, she made the interview 3 years later. But maybe we'll see, but I want to show you my video that shows all the theory very well, so that's why I want to run. Very high success rate if you can reach it. Sodium bicarbonate is really effective. Taking account that for the skin cancer you have to use the iodine tincture peculiarly given. Really 90% for melanomas. Orally, I told you, surface tongue, stomach, liver, little bit. Intravenously, thyroid, larynx, lung, brain. Also catheterization, artery. Local injection, breast, soft tissues, lymphomas, not big, not thick. colonoscopy, sigmoid rectal intestine, select arteriography, liver, prostate, brain, uterus, limbs. I have also many patients completely healed from prostate cancer, real prostate cancer. But they have to get catheterization of the prostatic arteries. They are very difficult procedure. You cannot say drink sodium bicarbonate. Player, I told you, operations, also when they are bigger. Oh, this is a selective arteriography of a rectum, rectal sigmoidal cancer. This is already Paparopoulos. This is a Greek patient that told me, I want to be never operated. So he came, made selective arteriography. After 1.5 months, this is the difference. This is a cancer in the upper part, descending colon. When I was a politician, one of the main party secretary in Turkey, he called me for a friend of him. The first day, they picked me up very gentle with limousine, Sheraton 28th floor to the boss, but everything. When I went to the hospital, all the professors looked at me like a dog. We are professor, hard, you know. Usually this professor have the voice of the in Italy there is an insect that speaks with the bottom, like in the summer. But they have the ties. This is the problem. So when I was there, all these stupid professors look at me like very ugly. I told my friend that told me, I want to come tomorrow to make the treatment. No, come, please, come. Oh, what kind of treatment is this? I come from Rome with all these stupids, and they look at me like a dog. Oh, please, be patient. So in the night, he arranged an orchestra, Turkish orchestra, because I told him, let me see something peculiar. So, okay, I will come. Because they came, I joke with them. So the day after, when I went in the hospital, everybody was like that. What happens? A miracle. That's why, look, they made a colonoscopy before I went to the hospital to say, this is a fake. So look what happened in one day. Look here, 6, 12, 6, 7, 12. This is the December. You know what happened? That's why okay, and I went away. So very, very effective. You go in touch. That's why the bladder, look here. This is the bladder, antes del tratamiento, es un mexicano, medico. Blood. He told me, doctor, pain, blood. Listen, in 7-10 days, sodium bicarbonate will cut off the tumor. Are you sure? After 7 days, he called me, doctor, there is still blood. Hey, wait a minute. After 20 days, the first cycle, tell me if you see the difference. Sorry. Do you see the difference? Yeah. Usually it is better to do 2 courses. 20 days, 2 weeks pause, rest, and other 20 days, usually 90% heal. They don't heal if the tumor is in the ureter, where you cannot reach it. This is a melanoma. I did it 2 months ago, 3 months ago. On the left side, then after the first treatment, the scar at the end. He gave me the picture. They want to operate, because the problem of the operation of the melanoma is that it metastasizes. People heal for a stupid illness. Melanoma, they can heal 99%. When they cut it, since the melanina is all over the body, the fungus has the food everywhere. So it can enter into the lymph node, to the liver, to the brain. It is very bad situation. Okay, we finish here, but I want to say, just a moment, that sometimes we fail. No, many times, because people come to me when they are completely dead, exhausted. But even when they have no chains, they can heal. I have people completely healed from peritoneal carcinosis, from incurable metastasis, but I want to show you just one video. Rod. Hey. No. Just iodine tincture, peculiarly made. You have to be careful, not put iodine tincture like that. You have to be precise. This is because it takes a long time that I do it. So it's not easy. Because if you make one mistake at the third day or the fourth day, you fail. Usually any melanoma can heal in 10 days. Any. Unless it is a melanoma like that. Okay, we can go on.
We have no sound, so, you know.
So put the microphone there.
There's no sound. Can you talk over it?
Patti?
The testimony.
Peterson. In June of 2008,
Oh, why there is no
I
voice?
was diagnosed with a tumor in my right kidney, and
Can you
it was
describe?
renal cell carcinoma.
All right, renal cell carcinoma. Renal cell, in August 28,
I underwent an operation.
I had operation and they cut off the kidney.
March of 2009, they had found
And
monitoring
1 year after,
renal cell carcinoma had actually moved into my
he had lung metastasis.
At that point, I went
And he went to the oncologist.
and when I was asking him,
What is the solution, he asked.
okay, what's the solution? He said,
And he said,
he indicated to me that normally
usually it can be operated.
or they can use chemo,
Or
or they could use,
make chemotherapy or radiotherapy.
and really,
But no one of these methods could work for you.
was this basically
This is a gentle way to say you have to die.
yes, it was.
Yes.
Basically, he told me,
He told me to go home and have the fun for the last months, I don't know.
the psychologist, if I needed them.
And he gave me the card of the psychologist to die better.
Welcome to the medicine of
Oh, welcome to the medicine of the third millennium.
I started talking to friends,
I spoke about Dr. Simoncini
Dr. Tullio,
with friends,
started doing research.
and I investigate all this job,
I realized after the research,
and I realized that he's a Canadian. That is, he had sense, my theory for him.
it just started making
And
sense.
to feel that the fungus was,
Just to talk to,
I don't know, he came to Rome, very clever.
we actually flew to Rome in July of 2009.
I had a clinic in Switzerland. We cooperated with the clinic because in Italy I'm
You can tell he was, a matter of fact,
we
we flew to Switzerland,
Switzerland.
associated, and I
We
started
met with my cooperator
back, and I finally went to
and started the treatment.
I was there
1 month and a half.
6 weeks. And I'm doing it, sorry, are you talking about the Simoncini?
Yeah, yes, my treatment.
So this is basically under Simoncini's
Yes,
supervision.
I supervised
Yes,
everything. I
absolutely.
went there.
It was, and so we, after the treatment, I was curious. We came back, had
I came back home after the treatment,
you can clearly see
and it was clear
for the PAT scans where the tumor
that
kept constantly growing.
the lumps were going continue to grow.
In some cases, it
But after they had the reduction size of 1/2 of reduction. So they become 1/2.
yeah, after the treatment that I had in August.
And after the treatment that I made in August,
In January and February of this
January, February, it continued. 2010,
I went back
He was alive.
to Switzerland. I mean, yes, I took
he went to Switzerland again.
and I went and I had a CT scan to follow up with my
And he made tomography, CT scan. This is the result, the
my
evidence.
tumors again had shrunk.
Say another time, 1/2 of the shrinking.
Yes. So I continued with another
2 weeks
of
more.
treatment and came back to Canada.
Got back to Canada,
The tumors, the last CT scan, which
and
the
on
first
the
one
last
got
CT scan,
returned. The tumors they were gone. All there was
finished. They
was scar
disappeared.
tissue.
This is still alive. He called me for friends, for...
August 2009, and one in January 2010. Yes.
Sorry?
You got rid of the tumors?
More or less is 6 months
Yes.
for the intravenous
Came back
administration.
from
With the
another CT
tantamine.
scan, which is again, it's now been another 3 months. I'm still clear.
Other CT scan
2010.
said it was clear.
That you were, you're still clear. Yes, it did.
Okay.
Just to make absolutely sure, did you do any treatment
So we cannot...
whether orthodox or
No,
not,
can't, no.
between the first and the last cycle or during the first and the last cycle,
video.
besides the
cannot.
bicarbonate?
Cannot hear.
In other words,
This is a
can you be
mess.
absolutely positive that the bicarbonate is what cured you? Yes, I can. There was no.
They
there
have
was no
one
treatment.
change when I come
What
here,
they
they
said, there was
doesn't
no
work.
treatment offered to me. What I was told was to
Your message is powerful.
relax and enjoy the ride. And fortunately, I have
He
6
says I
children,
have
7
six
grandchildren, and I wasn't really ready to do that. And by
And I want to live more. So this is...
meeting Dr. Simoncini, well, I'm still here today, and I'm
Okay.
very thankful. I thank God for that.
I think that. Okay. Sorry, I don't know what to do. So we don't go on?
You want to talk more? You want to take questions? You like
I
questions?
got a question for you.
But it is not possible to...
If you want to describe, there's,
Eh?
Can we get it?
No, because it is a 20... Maybe you can get it.
it's 20 minutes.
Movies like that on my computer.
Maybe you can take it. But look, listen, I have made a lecture in Los Angeles on September. There are 2-3 new cases here, because it is always updating.
I have it, and I'll post it on my wellness center website, which is lacasaspa.com.
Oh,
Okay.
thank you.
Okay.
Can we repeat that
La
again?
Casa, it's Espanol, La L-A-C-A-S-A, lacasaspa.com. It'll be posted through YouTube.
Okay.
I'll
But
have
this
it-
is the last lecture. Or the video.
No, everything that you've said today and the video.
Oh, okay.
It's on my
Good.
phone.
Put the video a little bit without voice. I want
Which
to-
one?
Just to show you.
Which one?
The last.
The last person in order of time to propose an actual cure against cancer is Tullio Simoncini, an Italian oncologist who finds himself in the middle of a storm
it's not possible.
after having declared his origin of cancer is not genetic, but it is due to the aggression of a fungus called Candida albicans.
Okay.
Based on this hypothesis, Dr. Simoncini treats cancer with sodium bicarbonate, and his rate of success is encouraging to say the least.
That the guy came back in the colon, was that in the colon? And you did what? You did an enema with it, or how did you get it?
Enema or colonoscopy if it is upper.
Okay.
It depends, but taking count that all we did here, it is secretly. So patients had to heal themselves by themselves. So one of these patients that is healed is 1,000 of the other patient with the big clinic that they can be followed by me. You understand me?
I understand.
But because I am persecuted, really, all over the world, because my idea is clear. Fungus, the cause of cancer. Everything you say about it, different, bye-bye, finish. The oncologist smashes down. But it will happen because the truth will come up one day. We cannot be ruled or deceived by this virtual world, false world. So 10 million people die every year. So this is incredible. They continue to say we can heal cancer. Okay, questions?
Yes, thank you very much for your, and you inspired me because I used the sodium bicarbonate homeopathically, with all respect.
Krista, would you speak louder for everyone to hear?
Yeah, really.
I was wondering if in your experience you noticed, because the French, les nous interno, they isolated the fungi
Who?
French pharmacopée. The French pharmacopée has that way back, and Dolisos produced this. And they talk about candida. It's a pity about the video, but have you isolated also Mucorrhizomonas as a fungus? And the Aspergillus niger?
In the fungi,
Yes.
in the tumor.
It's not only candida. I've tested this.
No, you have to be careful.
I know.
Because sometimes when there is a fungus, you can the tissue becomes so weak they can be attacked by hundreds of.
Exactly. So I'm saying it's a clustering.
No,
But I
but the
ne-
cause is the one that can produce masses like animals. Only the fungus can do it. If you have a virus, it can attack as well. You can find the viruses, but they don't do masses. They are intracellular. If you bacteria, they make infection, but they cannot do masses. The difference is that the fungus is the infection that makes the masses. This is the difference between. It is not a cellular living being. At the beginning, then it becomes an animal. Different. This is our weapon, conceptual weapon, have to change.
I understand.
Okay.
But I'm talking the fermentation climate is the climate for cancer to thrive on.
Yes,
And I see
everything.
candida there, and with all respect, I'm just asking if you have noticed in your research more clustering of other fungi that keep coming on together with the candida. That's all.
Listen,
Difficult?
this is a difficult
Okay,
question
okay.
because if I do something, I cannot do another thing.
I understand.
The microbiologists from Massachusetts came to me and they wanted to study with me all the problems with the candida cancer. I told them, listen, I give you the idea. I don't like to do it because I am not a pensioner. I don't like, no, me. I respect all the doctors and microbiologists, whoever works on medicine, but I am not keen to do it. If you want to do it, I can guide from here, I can give you my idea. I don't want to come into the laboratory. I have other problems. I have to defend myself from the institutions. I have to research by myself because we have no other ways to do it, because I asked the ministry, medical association to make a research, but they don't listen to you. Also, sometimes I have also to leave because half part of my life is on the airplane. So I cannot do this kind of research. I'm sorry. But there are works in Sweden, in Greece, they took a sample of a tumor, for instance, breast cancer, and they found only fungi. So they start. There is, if you go to PubMed, this is the online magazine of
Library of Medicine.
yes. If you go there, you digit sodium bicarbonate tumors. The more advanced studies on cancer, they say sodium bicarbonate works. Sodium bicarbonate works. Now, if you go, but they say they don't accept the etiology of fungus. They say the sodium bicarbonate works because it's anti-acidic. The story of the acidity and the alkalinity on cancer is a tale. This is not true. It is completely false. The alkalinity has nothing to do with the cancer. You have many colleagues, many friends. No, this is an infection.
Dr.
So-
Simoncini, could I respond to him? I would like
Can
to
you?
say to this gentleman. Is it okay if I
To
say
what?
something? I just want to say something to him.
Okay.
I had a patient just a couple of weeks ago who had breast implants, and she had fungus growing all over. She had explants, and they were trying to clean out all the fungus. And I have a system whereby I scan for frequencies, and I saw both of those fungi that you mentioned in her, and they're throughout her body, and she's been very sick, and she's got to clean out all the fungus before
Okay,
she's going to
thank
get
you.
better.
Thank you, my friend. Another question.
What's your website?
www.cancerfungus.com. www.cancerfungus.com.
And Dr. Simoncini, your book is available, yes?
Yes, if somebody wants to see some ideas, there is my book, when I finish I come and I can sign for my friends. Who could buy a book is my friend, because not because I accept books. No, yesterday Susan told me, hey, listen, where are the books? I told her, they are under my table. Be careful. But what do you want to say? There are the books, I keep them. No, I don't care about books. I do care about the bag, because I can travel very well, because waterproof. So this is the problem. Okay.
One more.
For the skin cancer, you said you like a particular iodine.
7% percentage. But you have to do, when you cure somebody, you have to be careful, because you can save the people, really. Because if they cut it goes, the first step is the lymph nodes. They cut another time the lymph nodes, and it enters all over the body. So you have to make like that. You have the spot. You encircle the plaque, okay, the tumor. No, don't go far, only encircle it. Then with the toothpick, you have to put iodine tincture. 1, 2. You have to wait the first touches. You have to wait that it gets dry. Then by the time 10 times, 20 times, it absorbs it. You have to do, maybe the first day you can do 80 times. The second day it is dry, so you can make in one time 150 times. But always you have to be precise. If it goes away, it doesn't form the scar. When the scar is arising, you have to go, this is the tissue, this is the scar that gets arising. You have to go behind with the iodine tincture, not scratch, you don't have to scratch. And iodine, after 3-4 minutes, will make the scar fall down. Then you wait, you put a little bit of iodine tincture, you wait 1 day, then you start again the same procedure. 150 times, if you are patient, even 200 times. After a couple of days, the second scar will fall down. At that moment, you put a little bit of iodine tincture, the patient is healed. Be careful, because if it is 2 centimeters, 3 centimeters, you can diameter, you can win. If it is larger, the reactive tissue is so big that the patient feels pain. So you have to do a big plaque, partially, 2 centimeters, here, 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 separated. Here, then, by the time you can attack the inner part. But usually, I say 90%, but I didn't fail, maybe one time. One time I failed because I had a woman that had the hair. But I also heal people with it. But she couldn't do better by herself. But you can save a lot of people.
So do you have like a video that shows you doing that?
Hey, I also have it, but I don't know where is it. Sorry, because people cannot understand. No, I have it. You know what is the problem? They try to put me in jail these last 3-4 years for nothing. I tried to set up a clinic in Albania where I have the license, and the patient came there and died. He didn't do any treatment. Oh, the institution from Italy started with an ambassador. They tried to shut me down. So I had to defend myself. So there is also, you need energy. You cannot do anything. So this is now I hope that I can start counterattack, because they bother me. Yeah. Liars. They are liars. But I will focus them, because I had to pay much money. But I focus them because they are, you know, the world is full of not dishonest, stupid people. Because it would be so simple. The chemical industries would earn more with my method, more than the chemotherapy. More. But I don't have, I shouldn't do catheterization, surgery. No, just 2 tablets per day, 2 shots per day in 10 days, done. They have the mind, they have to change their mind. You have to know that one of the last antifungal drug, that is a caspofungin, you need to do 60 shots in 1 month. The cost is €1,000 a vial. So it's more expensive than the chemotherapy, but they don't understand. It is like, you remember Teofrasto Bombastro von Hohenheim, it was Paracelsus. They shut him down. They said he was mad because he just found the spagyrica. So divide the substances in a plant, in a herb. He was the father of the pharmacology. But now they do the same. Any real big revolution, tell me one revolution that was not shut down. Scorbutum, a vaccine, penicillin. The last one is Barry Marshall, that is the one that discovered the Helicobacter, banned 10 years. Then they gave him the Nobel Prize. This is because you delegitimate all the oncology with this theory. They react. But we have to be humble. Humble. We have to research, especially when we have no results. Any other question? Okay. I thank you very much. See you next time.